A measles outbreak in the state of Texas is growing. Reports indicate an unvaccinated child has died, and that marks the first death from the measles here in the U.S. since 2015. This outbreak has grown to more than 130 cases and has also spread to New Mexico. Doctors with CBS News say this virus is extraordinarily contagious.
In addition to it being very infectious, it has a long incubation period.
What do you mean?
So when you get it, if you were to get infected, it would take 10 to 14 days for it to actually get sick. During that time, you could travel all over the place.
And spread it.
And spread it to an airport, to a store, feeling fine.
Measles symptoms include a high fever, cough, watery eyes, and a red body rash. Doctors stress the measles vaccine given in 2 doses is 97% effective against the virus. And while there's not an outbreak in our region, health experts say now is a good time for kids to go and get the vaccination if they have not yet. Silver Barker, she spoke with leaders at the Lucas County Health Department. Silver, is there a big reason to worry about this recent outbreak?
Well, Jeff, health officials say this is a highly contagious illness, and although they say people shouldn't panic with spring break right around the corner, though, they're highly recommending people get vaccinated. As a highly contagious illness spreads in another part of the country.
Right now is a really important time to go ask your doctor for an MMR vaccine and get vaccinated right now and get your kids vaccinated.
The CDC recommends the first dose happens around 1 year old and the second between ages 4 and 6. Lucas County Health Department Medical Director Dr. Megan Lutz says 76% of 6-year-olds in the county got vaccinated this school year. But vaccination rates in general have declined.
In the 2019 year, when this comparison study was done, we were one of the states that was doing really well. So we've actually quickly changed our vaccination pattern in the state of Ohio for the worse.
And while health officials understand not everyone can get vaccinated, taking extra precaution, as you would with other airborne illnesses, can help.
So avoiding large crowded places, practicing hand washing with soap and water is a really big deal. And just trying to avoid being around sick people is the best we could do aside from vaccine.
ProMedica pediatric emergency physician Dr. David Geisinger says kids and seniors are most vulnerable to the illness, but more so kids.
Now the very old, they may have more immunity from, before we had the vaccine. If they had gotten measles when they were younger, they're probably have more immunity.
And Dr. Geisinger says symptoms include cough, runny nose, and pink eye, which is also similar to other viruses, but a characteristic rash is usually what gives it away. The average onset of symptoms is around 11 to 12 days, but Dr. Lutz says people likely will not get the rash until 14 days in to being affected. And as far as in getting vaccinations, the health department, hospitals, and urgent care are all offering the vaccine. Reporting in studio, Silver Barker, WTOL 11.